Shruti is also doing thumbs up. Superb. Okay. So that's good. At least I know कि ये chat पे आने के लिए आज लोग खुश हैं. That's the first important thing for us to begin anything. Okay. Now I would like to tell you about मेरु चिकित्सा. मेरु दंडम या मेरु जो हम बोलते हैं उसे स्पाइन कहते हैं, राइट? किसे पता है इसे स्पाइन कहते हैं? Yes, superb. Yes, Satya ji, I am going to speak in English also. So Meru means the spine. Okay. And what does Chikitsa mean? Does anybody know what Chikitsa means? Does anybody know what Chikitsa means?
Yes, it's treatment.
Yes, somewhat, but not treatment. But good try, Deepika ji. Chikitsa means setting yourself right. Means अपनी रीढ़ की हड्डी से अपने आप को बेटर करवाना या अपने आप को हमेशा हर मोमेंट में बेटर करते रहना. ओके, दैट इज चिकित्सा, मीन्स सेटिंग योरसेल्फ राइट. क्योंकि क्या है ना, हम हर मिनट, इन एवरी मिनट वी आर लिविंग द प्रेजेंट मोमेंट. अभी जो मैं बात कर रही हूँ वो प्रेजेंट मोमेंट है एंड दैट इज इनएविटेबल. सो हर सेकेंड में हम अपने आप को चेंज करते जा रहे हैं. अभी भी आप जो इन्फॉर्मेशन सुनेंगे हर एक सेकेंड के बाद आप एक न्यू रिन्यूअल होगा आपका. So that is what we mean by चिकित्सा, means setting yourself right. अब हम ये क्यों सीखना चाहते हैं और स्पाइन क्यों इंपॉर्टेंट है? Does anybody know why spine is important? Can anybody answer why spine is important? Okay, I will tell you. Support. Okay, okay. Anybody else?
It is the center of my universe.
Okay, very good. Why do you say that center of your universe? Okay, I will tell you.
Reflex actions.
Okay,
Because
good.
all
Reflex
the
action.
nerves are connected to the spine.
Excellent. Who was that?
Indra Chaudhary.
Indra ji. Superb. Excellent answer. So I am going to explain you from where our spine came. Okay. जब हम एक छोटे से सेल थे ना, very tiny cell, एक छोटी सी पिंक लाइन हमारे सेल में पहले अकर हुई थी. ठीक है, सबसे पहले एक पिंक लाइन आई थी और वो पिंक लाइन हमारी रीढ़ की हड्डी है. ठीक है, वो हमारा स्पाइन थी और वो पिंक लाइन से हमारा ग्रोथ हुआ है. हमारा ब्रेन, हार्ट, एवरी ऑर्गन, एवरी पार्ट ऑफ आवर बॉडी हैज ग्रोन फ्रॉम द स्पाइन. जैसे एक ट्री अपने रूट से ग्रो होता है वैसे ही हमारा शरीर स्पाइन से ग्रो आउट हुआ है. ओके, गॉट इट? गॉट इट? व्हाई स्पाइन इज इंपॉर्टेंट? ओके, टेल मी वन थिंग. जब आपने देखा किसी के आपके नेबरहुड में या किसी को आपके फैमिली में पैरालिसिस हो गया है या उनके पैर नहीं चल रहे हैं या उनके हाथ नहीं चल रहे हैं, you must have seen somebody in your family maybe has a stroke. So why does that happen? That happens because ऑर्गन नहीं चल रहा है ऐसा नहीं है, या पैरों में प्रॉब्लम है इसीलिए नहीं चल रहा है ऐसा नहीं है. इट्स क्योंकि रीढ़ की हड्डी जहाँ पे हमारा नर्वस सिस्टम होता है जो हमारे पैरों को सिग्नल करता है चलने के लिए, वहां पे कट हो गया होता है. ओके, ऐसा नहीं है कि पैरों में कुछ प्रॉब्लम है इन पैरालिसिस. ओके, गॉट इट? गॉट इट? व्हाई स्पाइन इज इंपॉर्टेंट? वो हमारा सबसे स्टार्टिंग इनिशिएशन है ऑफ बर्थ. दैट इज हाउ इंपॉर्टेंट इट इज, राइट? So now we know why we're doing Meru Chikitsa, why we're learning about Meru Chikitsa. Okay, super. Okay, tell me one thing. आप में से किसको चोट लगती है तो किसी खुद हील हो जाता है, ऐसा किसने ऑब्जर्व किया है? वेरी गुड श्रुति. किसको और चोट लगती है और वो खुद हील हो जाता है? कभी कभी हमें ब्रूज हो जाता है, हमें पता भी नहीं चलता कि हमें ब्रूज हो गया है. एंड वो हम देखते हैं कि अरे हाँ ये तो अभी लाइट हो गया है, लाइट होते जा रहा है. सो क्या है, बॉडी की अपनी एक खुद की एबिलिटी है हील करने के लिए. द बॉडी हैज इट्स, वेरी गुड आरती, द बॉडी हैज इट्स ओन एबिलिटी टू हील इटसेल्फ, राइट? हम एंटीसेप्टिक क्यों लगाते हैं? ताकि वो जस्ट सेप्सिस ना हो जाए, नॉट एक्चुअली टू ट्रीट इट. सो यू अंडरस्टूड द बॉडी कैन हील इटसेल्फ? यस, सुपर्ब. नाउ आई वांट टू अंडरस्टैंड कि व्हाट डू वी वांट टू नो इन मेरू में ऐसा क्या है जो उस बॉडी की हीलिंग को इनिशिएट करता है. ओके, सो मेरू में हम बहुत ही जेंटल टचेस करते हैं ऑन द स्पाइन. ओके, वेरी वेरी लाइट जेंटल टचेस, एंड एक ब्यूटीफुल सी ब्रेथ वेव आती है स्पाइन में which starts to heal every part of the body. Because I told you, right? जैसे nerves center, आपके organs center of the spine से connected है, वैसे automatically जब हम spine को ठीक करते हैं या हम spine पे काम करते हैं, your healing starts to take place. Okay? Superb. Now I want to know कि how many of you have experienced pain? किस किस को दर्द हुआ है लाइफ में? किस किसने एक्सपीरियंस किया है? वेरी गुड. चंदा जी, प्रतिभा जी, हैव यू एक्सपीरियंस पेन? वेरी गुड. विद्या, वेरी गुड, यू हैव एक्सपीरियंस पेन. हु एल्स हैज एक्सपीरियंस पेन? दर्द किसको होता है? दर्द किसने किसने महसूस किया है? वेरी गुड. लिप्सा, ओके, यू हैव एक्सपीरियंस पेन. ओके. नीरू, okay, what is pain? Can anybody tell me what is pain? What is your definition of pain?
It's a signal for stimulating the body to heal itself.
Okay, good. But what is really pain? That is something that you said in terms of healing. But what is really pain? Discomfort. Okay, Neeru. Good. So pain is basically stuck prana. Right? Does everybody agree with me? Why do we do so much of meditation, breathing? Why do we do so many things? Why have we heard all gurus and all almighty people tell us that you should meditate, you should breathe in, you should keep doing some breathing exercises, breathing techniques? It's because pain is stuck prana. Okay? And with the help of Meru, we give it the touches on the spine so that the prana moves. And as soon as the prana moves, that healing takes place. You know, you must have observed जहाँ पे आपको pain है, it's very restrictive. It's like as if आपको किसी ने बंद कर दिया या आपको जकड़ लिया है, right? So मेरू के टेक्निक से हम automatically वो waves ला सकते हैं या वो breath ला सकते हैं ताकि वो वो energy खुले, that center opens up. You know, we have 1,72,000 nadis in our body. And nadis means the energy centers. So imagine so many energy centers open up when we do Meru. That's how beautiful it is. Can anybody understand? Everyone's able to understand till now? Yes, PCOD can also happen due to stuck prana. Everything, actually everything in our body, all diseases in our body is due to the stuck prana. Because the breath is not able to get completed. You're not able to, there's not enough energy in that area that is able to transform, so वो जो चीज है जो बन जाती है, system जो बन जाता है, energy is not able to push through that. So sometimes we need to take help externally to kind of get free from our problems, not actually problems, but kind of let the prana moving, because pain is also a protective mechanism of the body. It helps you know that, okay, you must pause in life, you must stop in life, you must see around, you must observe or get awareness in that area. Okay? अब तक सबको समझ में आ रहा है? Any issues? Okay, now I want to know ki, how many of you all already practice breathing? Or how many of you all, okay, Pratibha ji, or who else practices breathing? Anybody else who practices breathing? Renu, very good. Lipsa, Mayank, very good. Superb. Okay, so why is breath important? Why is the breath important? Can anybody answer why is the breath important? Releases toxins. Okay, very good. For energy, it is prana. Excellent. Superb. So what we're trying to do through Meru, is that by, sometimes just by on our own, we are not able to, we're not able to feel that wholeness with ourselves. We're not able to really find that space to bring that awareness in that, जैसे हमें कोई pain है या हमें shoulder में कोई issue है. Can we always solve it by ourselves? Can we always solve it by the breathing techniques we're practicing? Is it always possible? So we take help. We take help from the doctor. We ask them what is the next step. Meera is saying no. Okay, correct. So Meru helps you just to experience the awareness in that place of pain. You know, कभी कभार आप डॉक्टर के पास जाते हो and you know you just tell them the problem and it goes away. किसी के साथ ऐसा हुआ है? मेरे साथ ऐसा हुआ है. You know, you just go to the doctor and you tell them the problem and you know you feel like okay, now it's 50% better. Who all feel all that? Who has felt this? It's because Meera, good, you felt this. It's because you know what happens, the awareness is more in that part, in that region now. You know, okay Leela, I'm going to try, मैं हिंदी में बोलने की कोशिश करूंगी. तो जहां पे दर्द है, अगर हमारी अवेयरनेस वहां आ जाए या हमारा ध्यान वहां पे आ जाए तो ऑटोमेटिकली वो चीज कम होने लगती है. इट्स लाइक आपके सामने अगर एक सीडी है, हाँ, और आपने बोला अरे नहीं ये सीडी नहीं है, मैं नहीं चढ़ूंगी, तो क्या होगा, आप गिर जाएंगे. करेक्ट, क्योंकि आपने उस सीडी को एक्नॉलेज ही नहीं किया या आपने उस सीडी को देखा ही नहीं. लेकिन आप बोलोगे अच्छा ठीक है, सामने सीडी है, मुझे पैर उठाकर चलना है, तो क्या होगा, आपकी अवेयरनेस ने ऑलरेडी आपको ताकत दी है, क्योंकि फाइन अभी हम नेक्स्ट स्टेप, हम अपना पैर उठा सकते हैं, हम आगे चल सकते हैं. राइट. सो अवेयरनेस बहुत सी चीजों को सॉल्व कर देता है, बहुत सी चीजों को सॉर्ट आउट कर देता है. ओके, एनी क्वेश्चंस अभी तक? एनी क्वेश्चंस? ओके फाइन. सो अभी हम थोड़ी सी ब्रीदिंग टेक्निक्स प्रैक्टिस करेंगे. ओके, नाउ ये ब्रीदिंग टेक्निक्स क्यों प्रैक्टिस करेंगे या ये क्या है? हीलिंग के लिए, हीलिंग होने के लिए देयर आर 12 स्टेजेस. 12 स्टेजेस हैं जिसमें हीलिंग टेक प्लेस करता है. ओके, उनमें से थोड़ी टेक्निक्स, ब्रीदिंग टेक्निक्स आई विल टीच यू, जिसमें हम हीलिंग महसूस करने वाले हैं. एवरीबडी रेडी फॉर इट? क्योंकि जो मैं बोल रही हूँ वो महसूस भी तो होना चाहिए ना. राइट, करेक्ट, या सिर्फ टॉक शो है? ओके, सो लेट्स डू इट. एवरीबडी विथ मी. सबके कैमरास प्लीज ऑन कर दीजिए ताकि आप समझ पाए हम क्या कर रहे हैं. एंड आई कैन सी एंड आई कैन करेक्ट यू. मैं आपको करेक्ट कर सकती हूँ अगर आप कहीं पे मिस्टेक कर रहे हैं. ओके, ऑल राइट. सो लेट्स डू द फर्स्ट स्टेज. फर्स्ट स्टेज करेंगे हीलिंग की. ओके, प्लेस योर वन हैंड ऑन द अदर. एक हाथ के ऊपर दूसरा हाथ रख दीजिए. Very good. Everybody place your cameras in front of you. Superb. Just relax. Take a nice comfortable chair or a seat. Bed पे मत बैठना, सो जाएंगे. Okay. Now place it over your chest. छाती पर हाथ रखें. नाक से सांस अंदर लेते लेते छाती को फुलाएं. Expand your chest while taking a deep breath in from your nose. Now from your mouth breathe out. फूंक मारे मुंह से और breathe out करें. Very gently, very good. Now you place your hands in the mid chest region. Again एक हाथ के ऊपर दूसरा हाथ. Breathe in, सांस लेते हुए ये एरिया को फुलाएं. Very good. Breathe out, फूंक मारे. अच्छे से वहां पे हवा भरे. वेरी गुड. थर्ड स्टेज, अपने पेट पर हाथ रखें. अब धीरे से अपना पेट फुलाएं और सांस अंदर लें. डीप ब्रीद इन, एक्सपैंड योर स्टमक. फ्रॉम योर नोज ब्रीद इन. नाउ ब्रीद आउट, फूंक मारे. एंड जस्ट रिलैक्स. हाथ अपने लैप पे रख दीजिए. जस्ट रिलैक्स फॉर अ मिनट. क्लोज योर आईज नाउ. आंखें बंद कर लें और इस स्टेज ऑफ हीलिंग की एनर्जी को फील करें. आपको क्या महसूस हो रहा है देखिए. हाथ अपने लैप पे रख दीजिए. हाथ नीचे रख दीजिए. ओके, स्लोली कंफर्टेबली ओपन योर आईज. आंखें खोल लें जब कंफर्टेबल हैं. एनर्जी अच्छी थी? ये लेवल की एनर्जी अच्छी थी? सबको महसूस हुई? ओके, नेक्स्ट स्टेज. दोनों हाथ सामने कर लें. ओके, वंदना सिंह, टिंगलिंग सेंसेशन इन द हैंड. ओके, सेकेंड स्टेज के लिए रेडी. हाथ सामने. ओके, अब हम हाथों को ऐसे घुमाएंगे और ब्रीद इन आउट करेंगे. क्लोज योर आईज, आंखें बंद कर लें और करते जाएं. Come on, go faster, फास्ट करें, फटाफट, हेलीकॉप्टर, फास्ट हेलीकॉप्टर. ओके, आंखें बंद करके हाथ नीचे रख दे, रिलैक्स करें, विश्राम करें. आराम करें. इस स्टेज को अच्छे से फील करें. ऐसा महसूस हो रहा है, फील करें. ये आराम से अब आंखें खोल लें. अब सब खड़े हो जाएं. ओके, सब खड़े हो जाएं. ओके, अब हाथ खोलना है, नाक से सांस लेना है और हाथ बाजू में छाती पर लाना है. लेफ्ट हैंड नीचे, राइट हैंड ऊपर और थोड़ा सा बेंड करना है और ब्रीद आउट. ब्रीद इन, सांस अंदर लें, ब्रीद आउट नाक से बाहर. ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट. एनर्जी को फील करें हाथ खोलते वक्त, हाथ बंद करते वक्त. ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट. अच्छे से करें, सांस लें अच्छे से. ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट, ब्रीद इन, ब्रीद आउट. कम ऑन, फास्टर. ब्रीद इन, आउट, इन, आउट, इन, आउट, इन, आउट, इन, आउट, इन, आउट, इन, आउट. एंड रिलैक्स. क्लोज योर आईज, आंखें बंद करें, आंखें बंद करें. इस स्टेज की एनर्जी को अच्छे से महसूस करें. Feel what you are able to experience in the moment, in the present moment. Just be in the present moment. Okay, now you can slowly open your eyes and take a seat. Slowly sit. Okay. Now I want to know किसको क्या महसूस हुआ. क्या तीनों तीनों stages अलग थे? Anybody saying yes? Did you feel different doing all the three breathing techniques? Was there a difference?
Yes. ऐसे ऑरा क्लीनिंग जैसे कुछ एक्सपीरियंस हुआ, जैसे कि कुछ लाइटनेस एक्सपीरियंस.
Lightness. Very good. Who is that?
श्रुति.
Shruti. Superb. Anybody else who wants to share your experience? Feel sleepy and lightness, Bhavna. Okay, that's good. You know why you felt sleepy, Bhavna? Because you came into yourself. You know, when you come into yourself, that's the most best feeling, no? Because that's when you can sleep. Harjeet is writing, yes, it was different and feeling so light. You know that, right? When feel refreshed. Very good, Jaya. You know, why does that even pain occur, or why does that even happen? You know, because we feel separate from ourselves. You know, example, जैसे आपका बहुत ही कोई करीबी इंसान है, you know, your favorite person in the whole world, and but आपका उससे झगड़ा हुआ है, तो what will you feel like? नहीं, ये मेरा पार्ट नहीं है, you know, ये मेरा हिस्सा नहीं है. He's not behaving according to me, or she's not behaving according to me. ऐसा हम फील करते हैं. Do we feel like that? But as soon as we feel like नहीं यार, ये इंसान हमारा ही हिस्सा है, she is a part of us, you know, नहीं ये हमारा ही है, तो ऑटोमेटिकली पेन कैसे चला जाता है, हैप्पीनेस फील होता है, लाइटनेस फील होता है. दैट्स व्हाट यू आर फीलिंग इन दिस मोमेंट, बिकॉज आप अपने पूरे बॉडी से एक महसूस कर रहे हैं. गेटिंग इट? यू आर फीलिंग वन विथ योर सेल्फ राइट नाउ. हाउ ब्यूटिफुल, नो? Neelam is writing, was feeling tightness in the chest and having breathing problem from a few days, but I can breathe nicely after doing this. Superb. See, already people are feeling so nice. I'm seeing such beautiful smiles. How nice. Okay, Kalpesh, there's a small pain in the right part of chest. You know why could Kalpesh assess that there is pain right now in the right part? Abhi tak usse nahi feel ho raha tha, but how come Kalpesh is feeling it right now? Can anybody answer this? Suddenly he's feeling pain after doing such breathing techniques. What is the reason? Because suddenly now Kalpesh's awareness, because of, yeah, superb, Shruti, Samar, Deepika, you nailed it. It's the awareness, correct. जब हमारा ध्यान उस चीज पर चला जाता है, you're becoming more one with yourself, you're becoming more aware, that's when you feel the pain. Superb, amazing. Okay, that is all that I wanted to let you know about Meru. And I also wanted to tell you that this is my personal story about Meru. I'll just take a minute from you guys. So, you know, I am a practicing physiotherapist and I have my own clinic in Mumbai. मेरा खुद का एक clinic है. But जब मैं Meru सीखी, it was not for the other. What I experienced was the change in myself. You know, हर मोमेंट को 100% जीना, ये मैंने मेरू के बाद एक्सपीरियंस किया. You know, as a doctor, it's so difficult कि आप हर वक्त अपना कंसंट्रेशन या अपना अपना फुल 100% दे किसी भी मोमेंट में. It's difficult because you have to just keep moving. But मेरू के बाद जो ब्यूटिफुल साइलेंस आया मेरे लाइफ में, जो ब्यूटीफुल प्रेजेंट मोमेंट आया, यू नो, इट्स सो इम्पोर्टेंट. यू नो, हमेशा हम या तो पास्ट में जी रहे हैं या तो फ्यूचर में जी रहे हैं. अच्छा, कल क्या खाना बनेगा, आज रात क्या खाना बनेगा, कल का तो कितना अच्छा था ना, अब परसों भी कुछ अच्छा बनना चाहिए. तो हमारे दिमाग में हर वक्त या तो पास्ट चलता है या तो फ्यूचर चलता है, बट हम भूल जाते हैं कि हम जी तो इस मोमेंट में रहे हैं. यू नो, वी आर लिविंग फॉर दिस मोमेंट, वी आर लिविंग फॉर this experience, this happiness जो हम every moment में feel कर सकते हैं, right? Correct? When you snap, you remember कि, or when you clap, you remember कि this is the present moment. ये हम आज अभी में जी रहे हैं, correct? So, मैंने अपने काम को साइड रखकर ये ये थेरेपी सीखी just because उसने मुझे एक बेटर इंसान बनाया, मुझे एक more present moment इंसान बनाया. And that was totally worth it for my journey, you know. So as a doctor, I can say, not only has it helped my patients, and you know, we have pre and post reports. हमारे पास pre and post patient reports है of patient with PCOD, with gynecological issues, kidney stones, migraine issues, complete muscle weakness, या you know, spine में changes होना, scoliosis होना, या कर्व्स बढ़ जाना. हमारे पास प्री एंड पोस्ट रिपोर्ट्स है, यू नो, कि मेरू ने इस चीज को बदला है. तो यस, ये मेरे पेशेंट्स को भी बेनिफिट हुआ है, बट सबसे ज्यादा आज ये मुझे बेनिफिट हुआ है. यू नो, दिस इज माय पर्सनल एक्सपीरियंस अबाउट मेरू चिकित्सा. सो यस, बाय शेयरिंग दिस, आई मीन आई एम रियली हैप्पी पीपल कुड आंसर सो ब्यूटिफुली. इतने अच्छे से आप सब जवाब दे रहे हैं यहाँ पे. सो आई वुड रियली वांट नाउ दैट we take questions, and I would love to tell you all whatever you all want to know, और या आपके जो भी सवाल हैं, I'm ready to take them. You can unmute yourself and ask, but just one by one.
Ji,
Hello.
Ji, is it the same thing as the spine?
Okay, so we'll just take one by one. Let's.
I think it will be a good idea for
Is it the
us to,
same thing on the spine?
Who is this speaking? Sorry.
Satyashri,
Pardon?
Satyashri here.
Satyashri ji. Okay. Satyashri ji, see, the thing is, no, what we just experienced is heightened level of awareness, or how the breath could change so much into our systems just right now. But जो हम spine पे करते हैं या जो हम technique spine पे practice करते हैं, they are different. They are done on a specific. They're given gentle touches and they're done it. So what I just did with you right now is to share with you how the healing happens through the spine. This is what you will feel when you experience it, or even greater, because there will be somebody else who will be bringing the awareness also in that space. जैसे हमने बताया कि awareness कितनी सारी चीजें change कर सकता है. Not just yours, but even the doctor's awareness on your problems can change it. And let me tell you, ये चीज सिर्फ doctors के सीखने के लिए नहीं है. Anybody can learn Meru, because it's just about awareness. It's just about the present moment. So everybody and anybody can learn Meru. That's how it is.
No, Dr. Riya, Dhanashri here. Is it
Yes,
okay
Dhanashri.
if we can invite either they can raise their hands or they can put their questions in chat. So we
Yes,
will
sure.
be able to attend.
Sure. So just put it on the
questions.
chat, then I'll
Maybe
just answer from there.
Yeah, that could be one thing. That
Oh, okay. Sure. So Alpesh is asking me, pregnancy में कर सकते हैं? Yes, Alpesh, it is. You can practice it, and even you can even get it done. Just whoever is pregnant can also experience Meru Chikitsa, because Meru Chikitsa बहुत ही safe है. इसके कोई भी contraindications नहीं है. हम एक 1 day old baby को भी दे सकते हैं. तो in fact my teacher Jim, Dr. James Stone, जिन्होंने मुझे सिखाया है, हम वो often बच्चों को ये treatment देते हैं. तो कैसे mother के chest पे baby को रख के हम उनको touches on the spine देते हैं. So बहुत cute technique है. So even a 1 day baby old can experience it. So yes, pregnancy is totally safe. Now RK Arora.
Ma'am, my
Yes.
wife has a problem of constipation. She is 72.
Okay.
So can this practice solve the problem? She has a great problem of constipation.
So Uttam Rao ji, right?
Yeah.
Yes. So yes, Uttam Rao ji, you can practice this and you can get Meru done on her. In fact, we have a lot of patients who have this constipation, or stomach जिनका clean नहीं हो रहा है, या chronic pains and chronic issues है, constipation बहुत time से चल रहा है. So she can definitely get it done on herself also. It's very safe and it's effective also. It's not just about safe. ये बहुत ही effective भी है. In fact, I'm a physiotherapist, लेकिन मेरे पास सारे दूसरे issues के भी patients आते हैं. In fact, today only I just treated my sister for constipation. So, and just 8 sessions say she is already 80% better without any medications. So, absolutely effective. You can go for it.
Dr. Riya,
मेरू प्रैक्टिस जो है वो आज होता है इतनी है और इससे भी ज्यादा कुछ करना है.
नहीं उत्तम राव जी, ये सिर्फ एक डेमो था ऑफ द ब्रीदिंग टेक्निक्स, लेकिन इसमें बहुत डेप्थ है क्योंकि हम टचेस स्पाइन पे करते हैं ना. तो दिस इज जस्ट अ पार्ट ऑफ इट. This is not the whole of it. This is just a small glimpse, maybe just 2% of the whole thing. So I will give you the details. I will be giving you all my number, Shailaja's number, who's been really sweet enough to bring me on this panel with you guys. So I will be putting my number down, her number down, so you can have a chat with us as to कैसे होगा ये आगे, या मेरू कैसे आप आगे ले सकते हैं.
Dr. Riya,
Yes.
I'm Dr. Harshika. I'm also a physiotherapist. So
Hi,
I've
Dr.
done-
Harshika.
Hi. So I've done the optimizing energy workshop
James Stone का, तो is it different from this Meru Chikitsa या is it the same?
See, optimizing energy जो है जिन्होंने एक्सपीरियंस किया है, it's a part of Meru Chikitsa. It is not the whole of Meru Chikitsa. Meru Chikitsa ऐसी, as a physiotherapist, if I have to advise you, see, you know, हम लोग काफी we deal with pains with, you know, lot of machines and stimulation देते हैं, and you know, there are all these external things that we use, जिसका hardly कोई 2-3 बार इफेक्ट रहता है, because we know कि वो deep नहीं जाता है, कोई भी मशीन का डीप इफेक्ट नहीं है, इट्स मोर प्लेसिबो. सो व्हाट वी एक्सपीरियंस विद मेरू इज कि अपनी ही बॉडी अपने आप को ठीक कर रही है. इट्स नॉट लाइक कि मैंने कोई एनर्जी डाली है या ये कोई रेकी है या ये कोई हीलिंग टेक्निक है, ऐसा नहीं है. इट इज योर बॉडी ट्रीटिंग इटसेल्फ टू बिकम बेटर.
So once if I learn this, I'll be able to give this to patients also?
Yes, absolutely. I am practicing with all my patients, and I am practicing with patients who don't only have pain but also a lot of other issues with the body, like organ issues है या aches and pains है या gynecological issues है. So everything we are able to practice with.
I would like to know the details of the
Sure, I will be just putting my number down, and I will be putting it on the group also, so that you know you guys can also note it down. Yeah.
Ma'am, I would like to know what is the difference between pranayama and Meru Chikitsa, because we are practicing pranayama since last 15 to 16 years.
Yes. See, I am myself practicing the Sudarshan Kriya.
Yeah.
You know, since a lot of years now. I think it's almost been 15 years since I've been practicing Meru Chikitsa. I mean, Sudarshan Kriya. But क्या है ना, Sudarshan, there is no comparison between the two. Sudarshan Kriya is a self technique. It's a technique to scientifically which is proven कि आपकी प्राणा को ऊपर रखता है, आपकी एनर्जी को ऊपर रखता है. But sometimes we are, you know, we need an external help for certain issues. जैसे yes, वो प्राणा मूविंग करता है, लेकिन certain issues require more awareness from somebody else. जैसे आप डॉक्टर के सामने जाके बैठते हैं, तो हाँ, आप कैसे बात कर सकते हैं उनसे, उसके ऊपर अवेयरनेस ला सकता है डॉक्टर, या उस पे चेंजेस ला सकता है. सेम थिंग, मेरू इज लाइक अ ट्रीटमेंट टेक्निक, एंड यू नो, आई मीन सॉरी, मेरू इज लाइक अ external treatment technique. Sudarshan Kriya is for the self. It's more breathing, it's more keeping yourself in the moment at that moment itself. Like, you know, Meru is more of somebody else's awareness on that part, if I have to actually rightly put it.
मैं यहाँ एक एक्सपीरियंस बताना चाहूंगा सबके लिए.
जी.
मेरे बेटे, ही इज अबाउट 40 years old, और उनको अर्टिकेरिया बहुत सीवियर था, पूरे बॉडी पर आता था. सब प्रकार की औषधियां लिया, सब कुछ किया, एलोपैथी, होम्योपैथी, पंचकर्म, लेकिन जब से उन्होंने सुदर्शन क्रिया किया, तो पहले दिन से उनको काफी 100% रिलीफ मिला. ही इज प्रैक्टिसिंग इट डेली, रेगुलरली करते हैं, तो उनका वो हो गया पूरा. और दूसरा एक्सपीरियंस ऐसा है कि मुझे 25-30 साल तक सर्दी का प्रॉब्लम था, एलर्जी का, सभी प्रकार की वो ट्रीटमेंट हुई थी फ्रॉम 1975 to 2005. बट व्हेन आई स्टार्टेड प्राणायाम, आफ्टर 1 year I got complete relief from this problem.
Superb.
Thank you so much.
Okay, next question.
Hello.
Yes.
मेरा क्वेश्चन रह गया, एंकिलोजिंग स्पॉन्डिलाइटिस इन नेक वर्टिब्रा.
One second.
Aurora.
Yeah, RK Aurora ji. हाँ, due to ankylosing spondylitis, my cervical vertebrae are calcified and neck movement is painful and distinct. Yes. See, ankylosing spondylitis is also एक autoimmune disease है. Means self से produce होती है. Right? Ankylosing में vertebrae या जो हड्डियां हैं वो सारी जुड़ने लगती हैं, या and that gives severe pain. So ankylosing spondylitis के लिए we would help you for pain relief majorly for pain relief with Meru. In fact, I have one ankylosing spondylitis patient जिसके साथ I have been working now since over 5 months, 4 to 5 months, and he had 80% pain था उन्हें, and today, as on today, he is on just 20% pain. Because क्या है ना, Meru can be used with every other modality. तो इन फिजियोथेरेपी हाउ डू आई यूज इट इज मेरू देने के बाद पेन इज ऑलमोस्ट लाइक नील और 20% 10%. सो जब हम उसके नील या कम होने के बाद एक्सरसाइज करते हैं तो उसकी एफिशिएंसी ज्यादा होती है. पेन कम होता है, इन्फ्लेमेशन बॉडी में कम होती है, तो ऑटोमेटिकली यू नो द एक्सरसाइजेस कैन बी डन बेटर, द मूवमेंट्स कैन बी डन बेटर एंड मेंटेनेंस बहुत अच्छे से हो पाता है बिकॉज एंकाइलोजिंग में मेंटेनेंस इज द इम्पोर्टेंट की पॉइंट. So we help you maintain that moreover with Meru. Okay.
Good evening. I am Seema Oberoi. I have
Yes,
this
Seema ji.
cervical problem, spondylosis, and I'm having this giddiness for more than 6 months. I
Okay.
got treated for my ear problem also. My ear was having some internal problem. It is cured now, but sometimes now also I have this giddiness. Even now I'm doing this exercise, last exercise, I
Yes.
felt giddiness.
Yes. So have you gotten it checked and what has the diagnosis been?
It's a cervical spondylosis.
Okay. Okay. Sure. So and you have been doing physiotherapy or have you taken Meru at all?
No, I've never done that.
Okay. So what I would say is, just come and experience Meru once. Wherever you are, wherever you can, just experience Meru once. You'll actually see the difference within your spine. So see, क्या होता है ना, सिर्फ pain relief नहीं है Meru. It also changes the way your vertebrae are. Okay. And this has happened. This is I'm able to say this because हमारे पास इसके pre and post reports है. There are a lot of my colleagues, a lot of my known people who have found changes in the spine. सर्वाइकल स्पॉन्डिलाइसिस में या तो कर्व ज्यादा हो जाता है या एकदम फ्लैट हो जाता है, कॉजिंग दैट कंप्रेशन, राइट, जिसमें आपको फिर नमनेस आता है हाथ में या पेन आता है इन द सर्वाइकल. सो वो क्या होता है, उसमें वर्टिब्रे में चेंज हो जाता है, उसकी पोजीशन चेंज हो जाती है. तो मेरू में जब अवेयरनेस मूव होती है, जब ब्रेथ मूव होती है स्पाइन में, द वेव जब आती है स्पाइन में, बिकॉज ऑफ दैट ब्रेथ और बिकॉज ऑफ द जेंटल टचेस ऑन द स्पाइन, ऑटोमेटिकली आपके स्पाइन का पोजीशन चेंज होने लगता है. Yeah. So that's how it helps. So you can just try Meru and experience the difference that it gives you.
Okay.
Good evening, ma'am.
Yes.
Ma'am, this is Priyanka.
Yes, Priyanka.
So ma'am, I want to ask you that my father has hurt his spine on L1 and L2. So
Okay.
I want to know how this Meru Chikitsa can help him restore his spine health and can it be normal again? मतलब पूरा
Yes.
normal हो सकता है क्या?
So see, क्या होता है ना कि पहली बात तो मसल्स को कैसे ट्रेन करते हैं. Does anybody know मसल्स को कैसे ट्रेन करते हैं? हम योगा करते हैं या जिम्नास्टिक्स करते हैं या स्विमिंग करते हैं. We do those activities ना, हम मसल को ट्रेन करने के लिए जिम चले जाते हैं. बट हमारे नर्वस सिस्टम को कैसे ट्रेन करेंगे टू वर्क बेटर फॉर अस? कैसे ट्रेन करेंगे? सो हम मेरू चिकित्सा से नर्वस सिस्टम को ट्रेन करते हैं ताकि वो हमारे लिए बेटर वर्क करे. सो प्रियंका, इन दिस केस वी वांट कि आपके योर फादर्स नर्वस सिस्टम बिकम्स बेटर, सप्लाइज better blood flow to the L1, L2 where he has had the fall. Because now, because of the fall and the compression, there will be less blood flow. There will be less, the completion of movement will be less. There will be restriction in the joint. All of those things will be the problems associated with the L1, L2 hurting of the spine. So with Meru, automatically when the energy moves, there is healing that automatically happens because आपकी body ही अपने आप को ठीक करती जाती है. Secondly, depends कि क्या टाइप का fall हुआ है या क्या टाइप का इंजरी हुआ है पेशेंट को. We always take that into consideration and we see कि क्या changes आए हैं spine में and then we practice Meru with it. You can actually palpate कि pain कम हो जाता है. Now movement restriction better होने लगता है. इंसान ज्यादा चल पाता है या अब वो फॉरवर्ड बेंडिंग नहीं कर पाता था बट मेरू के बाद कर पाता है. सो यू सी ऑल दोस चेंजेस एंड यस, वो ऑटोमेटिकली ठीक होने लगता है. विथ मेरू वी हैव सीन दैट इवन इंजरीज, इवन फॉल्स गेट बेटर. एक एक्टिविटी है जब हम पेशेंट्स को कराते हैं, वी मेक देम बेंड फॉरवर्ड, हम उनको फीट टच करवाते हैं. और हम देखते हैं कि कहाँ तक उनके हाथ जा रहे हैं, और किसी किसी के सिर्फ नीज तक जाते हैं, किसी किसी के सिर्फ एंकल से थोड़ा ऊपर तक जाते हैं. बट आफ्टर मेरू, बिकॉज द स्पाइन बिकम्स सो गुड, उसके अंदर कितना अच्छा सप्लाई आने लगता है ऑफ एवरीथिंग, वी सी दैट द पेशेंट इज नाउ एबल टू टच द फ्लोर, or even lower than where they were originally able to bend. So, you can see the changes that will happen in the spine. Yeah, Priyanka?
Yes, ma'am. And ma'am, one more question: that how many sittings, minimum sittings, will it take for him to get relieved of his spine problem?
So, Priyanka, I'll have to understand from you personally that, and then I will have to take an assessment and then understand how many sessions will be required, because I need a detailed assessment on the same.
नाशिक ना हो तर मराठी सेल आपने जे इधर
Thank you so much.
Hi, hi ma'am. This is Kalpesh here.
Yes,
So just I want to know ki is it useful in diseases like skin diseases like psoriasis?
Just one second, I can't hear you. Just one second. Just one second. Anashri, can you mute everybody? Anashri?
So admin, please mute.
Just one second. Yeah.
Yeah. So I want to know ki is it useful in skin diseases like psoriasis or eczema?
See, everything and anything, it's going to definitely help, because understand one thing, spine जब center हो गया body का, या आपके हर प्रॉब्लम का सेंटर हो गया, राइट? बिकॉज स्पाइन सब कुछ स्टोर करती है, स्पाइन मेमोरी स्टोर करती है, बिकॉज इट्स द मोस्ट फर्स्ट थिंग दैट अकर्ड इन द बॉडी. तो इट स्टोर्स एवरीथिंग, इवन द एक्स एंड पेन्स और इवन द इमोशनल एक्स एंड पेन्स दैट यू बेयर थ्रू. सो एक बार स्पाइन को करेक्ट करने लग गया, यू ऑटोमेटिकली अलाइन द स्पाइन, इट हेल्प्स वेयर इट इज रिक्वायर्ड. सो डेफिनेटली स्किन इश्यूज में भी हेल्प करता है मेरे, no doubt at all.
Okay. Thank you.
Hi Riya, I'm
Hi.
Shailaja here.
Yes, Shailaja, tell me.
I am suffering with cervical spondylitis and I'm unable to lift even half kg also.
Okay.
With Meru Chikitsa, can I can do lifting and all?
See, Shailaja, firstly, I don't know if you have gotten yourself assessed from a doctor, whether the diagnosis of your cervical issue. Secondly, have you taken any treatment earlier?
Yeah, I have taken.
Okay.
But
and have you benefited from it?
Benefited, but lifting, a doctor advised me not to lift the weights, and I should not do chin lock.
Okay. So, you've done physiotherapy, is it?
Yes.
Okay, sure. So, has he given you the progression? Like अभी हम ये step पे हैं, अभी हमें आपको next step देना है, क्योंकि वो progression में आएगा आपके. अभी आप stage 2 पे होंगे, but maybe stage 5 पे they will give you the weight training.
No. They have given some physiotherapy, and after that they said to continue it. That's all.
Correct. So now what I would suggest is कि आप पहले जो आपके activities है आपको continue कीजिए, but then later go back to them, because हर चीज का एक progression होता है, ठीक है? Like day 1 what you are doing exercises versus after 2 months what exercises you are doing, they have to be different. It cannot be the continuum of the same things, because it's example, अगर हम day 1 gym जाते हैं और हम 1 किलो उठा रहे हैं और हम 2 महीने बाद भी gym जाकर 1 किलो उठाएं, so will it make any sense?
Yeah.
You getting it? Okay. So you have to go back to your therapist after the time span. If a good therapist will guide you as to how much time span you should be exercising this for. There has to be a time span for everything.
Okay.
Yeah.
Will it be curable actually?
See,
weightlifting problem.
Yeah, definitely. Of course. You can go back to. So I always tell my patients, जिनको osteoarthritis भी है, knee pains है, या inflammation है joints में, या cervical spondylitis है, I always tell them, you'll become so fit, you'll be able to go mountain climbing. Because क्या है, it's finally the healing that happens with Meru, the changes that happen with Meru. and then we do the exercises to support it. So you have the muscle strength also to take it forward.
Okay. Then you are suggesting to go for first physiotherapist?
Yes.
Or
And
Meru
also
Chikitsa?
no, please go for Meru, because what will happen is first your pain reduction needs to happen. The changes in the spine need to happen. The correction of alignment of the spine needs to happen so that you can experience the pain-free exercise, For me, I always work hand in hand. I'm not just working with one thing at a time. So Meru is a gift for me today, the biggest gift I could have ever gotten. And I'm not even exaggerating, because it helps me reduce the first thing the person comes with is, आज मुझे बहुत pain है. That's the first thing you will come with, or any patient comes with. So if I'm able to relieve and give them that smile on their face, isn't that worth it? So that's what we make you experience with Meru. The first relief or the feeling of the first feeling. It's not about the pain goes or immediately the pain goes. The awareness goes there. The work of the spine takes place. The pain may just increase also sometimes because the awareness is now there. But isn't awareness a beautiful thing? It will automatically help the change happen in you. So just that lightness which you felt after the breathing that we did today, that is exactly how you feel after Meru.
Okay.
So go for Meru.
Can I get that clinic address and all?
Yeah, sure. So I have put my numbers down. I have put my number down on the group so that you can just WhatsApp me and I'll just send you the addresses.
Okay.
Yeah.
Thank you, Riya.
No problem.
Thank you very much.
से आप अगर लेना चाहो तो.
Can we get the number, please?
Yeah, sure. I have already put it down on the group. I am going to just put it down again. Okay, I'm just putting my number down again. Yes, any more questions?
Dr. Riya, Vivek Shukla here.
Yes, Vivek ji, बोलिए.
What I want to know कि क्या इससे घुटनों का दर्द ठीक हो सकता है क्या?
Diagnosis?
Diagnosis.
हाँ, मतलब आपका घुटनों का दर्द किस वजह से है?
It's like arthritis or maybe some
Yes.
cartilage damage.
Yes. Meru definitely helps with osteoarthritis. In fact, my own grandmother suffers from it, from osteoarthritic changes. But she, as soon as I give Meru to her, see, just understand, ये pain relieving technique नहीं है. It's a self-awareness technique. Okay? Everything, the pain will come so that the awareness will come. Okay? Yes, in turn the pain will go. Our concentration is not to remove pain. Our concentration is to align the spine so that your body can repair itself. Okay? So that is an eventual resultant that you get out of it. But don't concentrate just on that. Just see the beauty. Everyone, I just say that, in fact, all of my patients, unbelievably, but I always suggest them at least learn one level of Meru. Because, that will teach you that it's not just the pain relief, but the awareness that can make so many changes. Imagine if you know the technique to always relieve your pain. Or, at least be in the 100% in the moment. Right? If you're 100% in the moment, how can pain even exist? So I always tell you, just go with the process and see, because every time you go, you will see something new, you'll feel something new, you'll feel something different. And eventually, the by process of this is pain relief.
Dr. Riya, for the duration for which this Meru treatment is being taken, there would be a relief, or what I understood is that the body gets into a process of self-healing because of the awareness being increased.
Yes.
But एक बार Meru लेना बंद कर दिया, because either it becomes like a regular exercise, so it has to come into habit, or it is like a treatment taken for a duration of, and then the healing process would continue, or because you are doing it as a practitioner, you are doing it day in, day out on your patients as well as practicing for yourself. But for patients, do they have to continue it throughout?
See, tell me one thing, before even what you just said to in this moment, has there a change that happened within you?
Yeah.
Correct. So every second that that every second there is a change happening. So the process, you never reverse. You never go back from the change that has already happened with that session of Meru. So there is never a reversal. Yes, but there are certain patterns that are stuck in our body because of which those pains exist. Everything is there so that you can learn something from it. Every pain in life comes so that you can learn or evolve from it, right? Is that correct?
I agree.
Right? So every time that you take Meru, there's some correction that's happening, not only in your aches and pains or in your body, but also the way you think. Even the psychological changes that happen in your body. So as long as your patterns keep changing with the Meru, your pains, your aches, or your tensions in the body, your tightnesses in the body, they start decreasing. You become less rigid. What happens when the prana moves in your body? Your body becomes less rigid. What I meant to say, when you bend forward, and we do the forward bending test, is that your body is now flexible. It becomes more open to whatever is happening with it, whatever changes happen with it.
दीदी एक क्वेश्चन मेरा है.
Thank you.
Yes, बोलिए.
तो मेरे हाथ के कार्पेट का ऑपरेशन कराया, तो ऑपरेशन कराने के बाद 3 अंगुली में करंट जैसा आता है, मतलब ऑपरेशन फेल कर दिया. उसने बताया नहीं, दवाई लेती रही, मोटी होती रही, फिर छोड़ दिया. तो अभी उसका कुछ हो सकता है क्या वापस? ऐसे किसी डॉक्टर ने बोला नस डैमेज हो गई है. 1 साल हो गया.
ये मंजू जी बोल रहे हैं?
हाँ, मैं मंजू बोल रही हूँ, सारी गुजरात से.
यस मंजू जी. सी क्या है ना कि यस, इसमें चेंजेस आ सकते हैं, कार्पल टनल में चेंजेस आ सकते हैं, लेकिन अगेन मैं आपको बोल रही हूँ कि गो बैक टू द डॉक्टर एंड फिगर आउट कि क्या है आपका नेक्स्ट स्टेप, क्या होना चाहिए. आई नो आपने बहुत सारी मेडिसिन ली है, बट जस्ट हाँ, तो दैट मीन्स आपका वो प्रोसेस आउट हो चुका है, लाइक अभी आप नहीं ले रहे हैं.
बंद कर दी. 1 साल हो गया, कुछ भी 0% भी ऑपरेशन के बाद फर्क नहीं. मेरा हाथ बिगड़ गया, लेफ्ट हैंड है, बहुत. ये 3 बीच की पूरी अंगुली दोनों साइड से, और ये सेकेंड अंगुली और फर्स्ट अंगुली का आधा, ये तीनों लिटरली करंट मारता है. मेरे को बहुत प्रॉब्लम होती है.
तो मंजू जी, then why don't you experience Meru and see how it changes?
वही मैं पूछना चाह रही हूँ कि इससे कुछ हो सकता है क्या?
यस, मेरे से डेफिनेटली चेंजेस हो सकते हैं. ओके, इस चीज से मुझे आपको एक चीज बतानी है, आप सबको एक चीज बतानी है. इस चीज से मुझे याद आ रहा है, एक लेडी है जिनको यूट्रस में सिस्ट्स हो गए थे, ठीक है, और उन्होंने अपना और जैसे सिस्ट होते थे वो क्या करती थी, उसका सर्जरी करती थी, निकाल देती थी. सिस्ट हुए, वापस सर्जरी किया, निकाला. फिर वो परेशान हो गई कि ये यूट्रस में सिस्ट आते ही जा रहे हैं, एंड अब मैं क्या करूं. तो डॉक्टर ने कहा कि आप यूट्रस निकाल दीजिए. तो व्हाट डिड शी डू, उन्होंने वो यूट्रस निकाल दिया. ठीक है, अब वो फाइब्रॉइड, वो सिस्ट, ठीक है, आपने यूट्रस तो निकाल दिया, लेकिन अब जाके उनको किडनी स्टोन डेवलप हो गया. नाउ विल यू गो एंड रिमूव द किडनी ऑल्सो? नो, राइट? बिकॉज क्या होता है कि उनको जो वो जो प्रॉब्लम आ रही थी, वो उनकी बॉडी प्रोसेस नहीं कर पा रही थी. देयर वाज समथिंग दैट वाज गोइंग ऑन विथ हर दैट शी वाज नॉट एबल टू प्रोसेस. तो उन्होंने क्या किया, उनको लगा कि ऑर्गन निकाल के रख देना इज इजियर ऑप्शन instead of dealing with what she needed to. Psychologically there was something going on with her that needed to change. So हम often इसको address नहीं करते. What is actually going on with us? We never sit with the pain. Like ये shoulder pain कर रहा है, ये हाथ pain कर रहा है, ये knee pain कर रहा है. अरे यार, हमारा shoulder है, it's my shoulder, it's my knee, it's my hand. उसको हम एसोसिएट नहीं करते. हम पेन के साथ हम पहले इसको नकार देते हैं कि बस अभी मुझे बहुत हो रहा है, निकाल दो. बट इट्स इम्पोर्टेंट कभी कभी कि आप उसको देखो, आप उस पर ध्यान दो अच्छे से. यू सी कि क्या है, या यू ट्राई टू सी द पॉजिटिव, या सी द रीजन बिहाइंड इट, क्योंकि हर चीज को तो आप बॉडी से निकाल कर फेंक नहीं सकते. सो ये जो पैटर्न चेंजेस है, या ये जो टू बीइंग एबल टू सी एट योर सेल्फ correctly or well is what Meru helps you with. Okay, so that you don't have to go down to doing those procedures. Yes, there are certain places जहाँ पे surgery बहुत important है. It's a matter of it's very essential. जहाँ पे required है, वहाँ पे we never suggest you to not go for it. But see, if there is something else that can be worked, if it's not an emergency situation. That's utterly if this is not an emergency situation. So I always suggest you first to see experience Meru, and then come up with the questions, and then come up with, yeah, like you can always tell me, yes, I experienced this, I experienced that, whether good, whether bad, whatever you experience. Yeah, Manjuji?
Hello, ma'am. I have a question.
Yes.
ये कहाँ पे कराना है?
मैंने आपको नंबर दिया है, आप मुझे व्हाट्सएप कर दीजिए. यू आर प्लीज जस्ट नोट डाउन माय नंबर सो दैट आई कैन गेट इन टच विद यू ऑल.
ओके. नंबर इस पे डाले क्या आपने?
यस, व्हाट्सएप पे है मैंने.
ओके. मेरे को करवाना
Ma'am, is
है.
it useful in digestive issues also?
In digestive issues, yes. Somebody just asked the same, Uttam Rauji just asked the same question. Yes, so absolutely. I have a patient who has had stomach issues since the past 5 years, and with Meru, she's now able to eat the foods that she was not able to eat. I have a patient जिसको 20 allergies थी, food allergies थी, which has come down to 7, just 7 allergies out of 20, which I have the pre and post reports of. So yes, these changes occur, but we don't concentrate just on those. We concentrate on a lot more than just your, all these issues in specific, because we're treating the spine. No, we're treating the center of your problem. We're treating the problem from its root. So it's going to definitely help you with your digestive issues also. So we are going to, I don't know from which place everybody is from, but we are holding Meru Chikitsa training courses all over India. We have it in Kerala, we have it in Mumbai, we have it in Bangalore. We have these courses running all over. So I'm going to even try and put the message up here if I can, or if you'll just WhatsApp me or Nitesh or Shailaja, anybody, we can always put it up on your WhatsApp so that you can get the information on where these courses are happening and where these treatments are happening, because we have numerous courses coming up right now.
Dr. Riya, if at all, we have what has been done right now, 3 of your number, that is Dr. Riya, Shailaja ji and Nitesh ji's number has been sent in the WhatsApp number.
Right.
That is being done. Second, what will happen is, if at all you have there are, as I understand your discussion, आपने जो भी बताया उससे हमने 2 चीजें जाना कि हमारे सेल्फ हीलिंग के लिए हम लोग मेरू सेशन ले सकते हैं आपसे, या और जो मेरू प्रैक्टिशनर्स है पैन इंडिया, उनसे हम मेरू सेशंस ले सकते हैं. और अगर हमें अच्छा लगे मेरू चिकित्सा सीखना लेवल 1, तो उसके लिए भी आप कोर्सेस अवेलेबल है आपके पास. तो अब मेरू चिकित्सा सीखने के कोर्स की डिटेल आप चैट में डाल सकते हो क्या?
I'm just going to try doing that. मैं मेल से ट्राई करती हूँ.
आप मुझे व्हाट्सएप मैं चैट में डाल दूंगी.
Okay, sure. I'll just put it across and you can just put it.
Yes. और साथ में तो जिनको इंटरेस्ट है वो ये करेंगे, और जिनको सेशन लेने में इंटरेस्ट है वो आप तीनों में से किसी को व्हाट्सएप करेंगे, ताकि आप उनको लोकेशन भेज दो जहाँ पे ये मेरू सेशंस वो कर सकते हैं, है ना?
यस.
अवेलेबल है. आपको अगर मेरू चिकित्सा के सेशन की जरूरत है तो मंजू जी 1 मिनट है, मैं आपको म्यूट रख रही हूँ. आपको क्या करना है, आपकी तरफ से आप ये व्हाट्सएप नंबर्स पे मैसेज करेंगे तो आपको आपका नियरेस्ट कोई लोकेशन का आपको बता देंगे कि कहाँ पे आप कर सकते हैं, है ना? और तीसरा चीज ये था कि आपकी डॉक्टर रिया, चैट में कुछ लोगों ने सवाल पूछे हैं, तो अगर आप चाहो तो मैं रीड करके आपको बताती हूँ. तो
यस, श्योर, थैंक यू सो मच.
सो शुरू में जो सवाल आए थे उसमें से एक था कि कैन वी रिपीट द ब्रीदिंग टेक्निक वंस इन सीक्वेंस एंड हाउ लॉन्ग शुड इट बी डन. मैंने ये आपने जो सिखाया आज वो कितनी बार करना चाहिए और कितनी देर तक करना चाहिए?
See, this is just, ये 3 अलग अलग पार्ट्स है आउट ऑफ द होल 12 स्टेजेस जो हम प्रैक्टिस करते हैं मेरू में. So yes, you can practice these on your own. You can do it once a day, twice a day also. लेकिन to completely experience it, I would suggest कि आप पहले या तो optimizing energy कर लीजिए. So optimizing energy is an online course which is conducted by Dr. James Stone, which is my teacher. He's from the USA, and by Dr. Shruti Chaudhary. So both of them take these optimizing energy courses. So जो मैंने अभी किया ना, उसका एक थोड़ा इससे बड़ा version is done by my teacher online. So whoever is not able to reach for the courses, they can always experience this, because then you will actually understand in depth, you know. So I will also put in optimizing energy details so that they are able to you know, figure out how to do this or how to go forward with these breathing techniques also.
ये एक था। फिर दूसरा चैट में जो सवाल है recently, will Meru help for autoimmune system like MOGAD? मुझे पता नहीं इसको कैसे
MOG. I think is this I don't know what that is, but if you're talking about autoimmune diseases जैसे multiple sclerosis हो गया या Guillain-Barré syndrome हो गया या आप you know, you're talking about ankylosing spondylitis, rheumatoid arthritis, it definitely helps, definitely helps, because ये सब क्या है ना, इनमें आपको एक वो टेक्निक्स करनी पड़ेंगी जो आपको ये मेंटेन कर सके। आप जहां पे हेल्थ में हैं, you will need the maintenance of that. So Meru is amazing because see, it's providing more supply, you know, to your organs. It's supplying more. It's more giving more blood supply to every part in your spine and across all muscles, joints, bones, everywhere. So it's helpful in all autoimmune diseases for sure. Tanashri, can you just WhatsApp me so that I'll just send it to you?
Hello.
Yes.
हेलो
हेलो।
कैसा लक्ष्य? हेलो, आवाज आ रही है?
यस।
हे भगवान। हेलो
हेलो।
उसको आवाज नहीं आ रही, पायल काटते लगा।
Let me read some questions from the chat once again for you.
Yes.
मैंने WhatsApp किया है आपको.
I just sent across to you.
Yeah, please share the optimizing energy details also, which I will send.
Yes.
Can Meru help in Mano? What is? I do not know.
Yeah.
Mano,
multiple sclerosis. What is it? Can Meru help in?
Mano-Avsad, ma'am. Mano-Avsad.
Sorry?
Mano-Avsad, bipolar depression.
Personally, I don't know of this question. I will get back to you on the same. If you just WhatsApp it to me, I will connect back to my teacher and I will surely get back to you on this. Personally, I don't know about this.
Thank you.
और एक सवाल है कि
Yes.
अपना ये रिकॉर्डिंग हम लोग कर सकते हैं क्या?
I don't know where accessible होगा. Dr. Tyagi, I think will be able to help you more with this.
So as of now, अगर ये रिकॉर्डिंग अवेलेबल होगा तो अपना जो आरोग्य हम ग्रुप है उसमें आपको ये चीज देखने को मिल सकता है. पार्टिसिपेंट अवेलेबल तो हम आपको YouTube का लिंक शेयर करेंगे कि आप ग्रुप में से इसको एक्सेस कर सकते हैं, है ना. फिर अगला एक और एक क्वेश्चन है कि कॉन्टैक्ट नंबर्स हम फिर से एक बार सेशन के एंड में नूतन जी डाल देंगे आपके रेफरेंस के लिए, ताकि यू कैन हैंडल उनको कांटेक्ट कर सके. फिर तीसरा चीज है कि जब भी हम कोर्स के बारे में, लोकेशन मुंबई में कहाँ है? जुहू में है बताया ना डॉक्टर आपने?
So my clinic is at Juhu and courses usually अंधेरी west में ही होते हैं, and I think hopefully we should be taking the course in June. Again, I will put. I've added one link on the. I've given one link to you, Dhanashri. So if you can just put it online on the chat here, that link will have everything. Your optimizing energy, including your next course happening in next city, location, details, contact numbers, everything.
Perfect.
Yeah, that link will have everything.
Yeah, so I will share the link. Meanwhile, Rohini ji is asking, can posture correction happen with Meru? I sit for 8 hours daily due to office work. There is a curve in the mid of spine. I'm able to do normal work and exercise, but not able to sit straight for long time during meditation. Can this be cured?
So, Meru Chikitsa has helped me even deepen my sadhana or deepen my meditation. It's amazing the amount of depth I am able to achieve after, experiencing Meru in my own meditation. So, yes, one is meditation aspect. The other is spine. Now, yes, when we are directly working with the spine, so the changes, the alignments automatically happen. So I think the curve probably which you're talking about is scoliosis, which is the S curve that happens in the spine because of, हम एक side ज़्यादा बैठ जाते हैं and then that हमारे जो bones है वो उस direction में curve हो जाते हैं. Scoliosis is definitely changeable by Meru Chikitsa. Just go and experience it, you'll come to know. Even with your aches and pains, even with your postures, Meru can help you a lot. It's tremendous. My own mother, because of asthma, she was an asthmatic patient. Because of asthma has, this kind of shoulders because of, so they're always trying to breathe, no? So they're always they're short of breath. The exhalation is not complete. So they're always like this. So you can see that there's a huge curve that happens in her back as well. That has almost now vanished after 4 months of Meru. So yes, corrections in the spine are definitely possible. Thank you, Pramod. Any more questions?
Contact details about the Meru, as well as the optimizing energy details from
yes.
In the chat box.
Does this help in mental well-being?
If you're talking about the feeling, I mean, if you're talking about mental issues like depression or, the ones that do not require medications, as in my information, yes, we are able to help you with that because see, depression is again when you're feeling the sense of emptiness or the sense of no purpose of life or, whatever the cause may be. So automatically when the energy moves in your spine, the sense of more feeling of oneness happens, the sense of more integrity in your body happens, in your mind happens. You start feeling one. So definitely with those cases, the changes, I have seen those changes happen. But with very deep mental issues, I'm not sure. I will have to get back to you. I will speak to my teacher, Dr. James Stone, and get back to you on the same information.
No, I'm not talking about chronic mental issues. I'm just talking about the moderate or the beginning ones.
Absolutely. So we have, I also have some students. I have a 13-year-old boy who has, confusion, mental confusion as a basic, issue in which he's not able to, he's too fast paced. Like if you see him in the room, he'll be just fidgeting or he'll be doing something, because something's always constantly on his mind. So that's just the start of an OCD or just the start of too much happening with the mind or the ADHD that happens. So yes, that child has now quietened down. That is my personal experience with Meru Chikitsa. So yes, at the beginning of the issue, that can definitely help. 100%.
Yeah, like starting of moderate and ending of beginning.
Yes, can definitely help.
Okay, thank you.
Dr. Riya, one more question is whether course will be online or offline?
So these are all offline courses. Optimizing Energy is an online course, which is 3 days and for 3 hours or 2 hours, something like that. But the Sri Meru Chikitsa level 1 course, that is the basic course of Meru, that is going to happen offline. That you will have to do offline because to experience the power of touch on a person's spine, to experience the silence or to experience what that present moment is, you will need to be there. You need to be present for that offline.
Okay. So Sri Meru Chikitsa level 1 will be offline and optimizing energy will be online.
Yes.
And the details will be available there, given on the chat, as well as if you feel more details are required, Nitesh ji, Shailaja ji, and Dr. Riya.
Yes.
These numbers are shared in the chat. So participants are requested to pick it up from there. And if you feel, we can, if you send it on the, if you are in the Arogya Dham group, if you send it to Abhay ji as an admin, he will share those details with you. Yeah. Then the next one is if the course is available in Mumbai.
Yes, definitely the course available in Mumbai. Mostly next level I will be also teaching. So yes, the course is available in Mumbai. The next dates I need to just confirm with my team as to what are the next dates. Yes, it's available. Andheri West mostly will be the location in Mumbai.
There is another question. Is the acupressure better for autoimmune disorder rather than Meru?
Yeah, I can never give you a comparative study of what I have not practiced. I have done Marma as therapy, and they are two different. They're very different because acupressure again is something that the person can do on themselves as well, can be practiced by themselves as well. But Meru is, and there are certain meridian points, where you practice. Meru is dealing directly with the spine. There is no meridians, there is no certain points in the body. So that's the major difference between both the therapies.
Would there be any courses happening in Gujarat?
Yes, there are courses happening in Gujarat as well. All the details have been put out on the group right now. But anyway, if you just WhatsApp me, I will be able to send you more details. Me or Nitesh or Shailaja, anybody. We'll get back to you with the details.
Shruti Chaudhary ji will be for Kerala also, right?
Yes, Shruti Chaudhary will be there for Kerala. I think they're already there with Dr. James Stone, my teacher, Dr. James Stone. They're already there in Kerala right now. They're conducting a camp right now. It's an amazing opportunity for those in Kerala. I mean, I would love to be there. So people who are in Kerala must experience it. And the camp is the energy in the camp, because there are so many people. The energy in the camp is beautiful.
Another question is it useful for hair fall or hair related issues like baldness?
See, why do those issues occur? Those issues occur because of something, some hormonal changes, some immune changes that occur. So, I think I would be more concerned with the immunity changes or the hormonal changes that may happen in your body. So first, just see and find the causative of it rather than, because hair fall and something is just a very, very external thing to happen. Like, there's nothing that I can comment on directly about it, but just see the causative, whether your vitamins are fine, whether your body mineral absorption is okay. Why is that happening? Just find the causative of it first. I would suggest specifically for hair fall. Every other issue is okay, but specifically for this issue, just see why it's happening.
There is a question about course. How many days the course is happening? Will it be 2 weekends like that, or what will be the duration?
Yes. So there are two types of courses that happen. One is the weekday or the general program which we have from. It's a 5-day course. First of all, the Shri Shri Meru Chikitsa level 1 is a 5-day course. It happens on usually the dates are Wednesday, Thursday, Friday, Saturday, Sunday. Those 5 days is usually when we try to keep it so that we can include the weekend as well. Then there is another way. There's another module. The way we keep the Shri Shri Meru Chikitsa level 1, which is the weekend courses. So what happens? That takes place over 2 weekends. So maybe the first weekend you have the 2 days, that is the Saturday Sunday is the first 2 days of the course, and the next weekend Friday Saturday Sunday is the course, or Saturday Sunday Monday is the course. So that people are even who are working. In fact, we have so many people from, different, very, very different backgrounds, from IT professionals, people working in banks who are my colleagues as well. So it's not like it's restricted to people who are in the medical field, but everybody can experience this. So yes, so we have those 2 modules the way this course runs. You can join anyone as your convenience and time.
Is there any eligibility criteria for doing Meru Chikitsa level 1 program?
Yes, Dhanashri, thank you for that reminder. So there is a Shri Shri. There are these programs, which is the happiness program, which is the basic course of the art of living. So there is a happiness program. There is a Sahaj Samadhi, which is in which there's a Bij mantra that is being given. That course, as well as one advanced course that you need to do from the Shri Shri, the Shri Shri courses to be able to, that's a prerequisite to doing these courses. But those are very short courses, 3-day, 4-day courses, which are 3 hours or 4 hours. Yes, the advanced course is a 5-day course, but to experience that in itself is also a beauty. So, you can maybe step by step every month do one course and then land up for the Shri Shri Meru Chikitsa course for all those who have not done the art of living.
And is there any standard cost for a session of Meru?
No, there is no such standard cost. It depends on which city the person is or, where you are. Yeah, the standard cost for the course is there, but not for the session as such.
And the number of sessions which are required, will it be decided by the practitioner? Can we get some guidance there?
Yes. So the number of sessions will be decided as per the practitioner who is going to be doing the Meru on you. They will be speaking to you. They will be first thoroughly asking you a lot of questions as to what are the issues, or understand from you first of what the issues are, and then devise a plan according to the knowledge of your problem. So it can be usually what I do in my practice is take the patient twice to thrice a week for about easily for a month or two, depending on the problem that is. So depending 1 month or 2 months, depending on that. But because the body forgets, there is a memory that your cells hold as well. So you need to give it that initial reminder, of that change that has happened. So we kind of take it close by. So we do it thrice a week or do we do it twice a week so that those changes are palpable. Those changes can actually be seen also and felt actually.
Bhavna ji is asking, is Sahaj compulsory? I haven't done,
yes.
No, but she has done this meditation breath workshop and advanced meditation programs. So can she
Sahaj
join?
is actually a mandatory one, but Sahaj is very easy. It's a 2-day course actually. Sahaj is a 2-day course, and which is only for 2 hours. You can do it online. Actually, all of the courses that are available, that are the prerequisites to doing the Shri Shri Meru Chikitsa, are all available online. So you can easily go on the Shri Shri, or you can go on the site of the Art of Living Bangalore or the Art of Living, and you can .org.in. You can go on that site and figure out which course is okay with you with the timings and with the dates. They are all available online except the Shri Shri Meru Chikitsa. Of course, that you have to go and experience it. But all the prerequisite courses are online. So from the comfort of your own homes, you can experience it.
There is Srimaji is asking, can Meru help in gallbladder stone?
Yes, Meru can help in gallbladder stones as well. See, I'm telling you, these are all specific questions, and I would, I would love to answer each all by one. But everything that you see in the body, if there is a change that occurs after Meru, it's automatically going to change the issue. Whatever it is, whether it is bringing the awareness there or bringing the prana in there, it's definitely going to change the issue.
So with that, looks like we have come to, most of the questions are answered.
Yes.
Naji has posted with Tanuma the details, and the registration link is available in the chat box right now.
Yes.
So those who are interested in doing the Sahaj Samadhi meditation program to become, learn the Shri Shri Meru level 1. Details can be picked up from the chat. Rohini ji is asking, what is the origin of Meru? Is it an Indian technique?
Yes, Meru Chikitsa is about 500 or 5,000 years old. This technique is actually very ancient. It's an ancient Ayurvedic technique, which has now just been revived by Sri Sri Ravi Shankar ji. And that's how we've taken it up, and that's how we're learning from it. And once you come on the course, there are beautiful and interesting stories which Dr. James Stone will tell you. My teacher will tell you about the origin and how Sri Sri Ravi Shankar ji, Guruji, brought this into his life and brought this into our lives. So he'll be the best person. So there are such amazing memories that I have from my level 1, and that's why we keep going back to learn them, because Dr. James Stone is a very, very beautiful person and very humorous. I mean, whoever just wants to just go and enjoy, just being happy, please go for the course.
Last question for the day is Rinki ji is asked, is it helpful to, I don't know how to pronounce, is it cute colitis?
I didn't quite get that.
Sorry.
You just type it. Okay. Acute colitis. Okay, colitis. Yes. Absolutely. Yes, Rinki ji. In fact, acute colitis, as well as I have treated somebody with fissures, and anal fissures, who's experienced burning sensations while going to the loo. They have also experienced changes. Burning is less, medications are almost nil. So, yes, with all these issues, acute colitis as well as anal fissures also, you can help it.
Some of you were saying that you do not have the link, the group is full. So I have given a link for alternative group of Arogya Dham. There are more than 50 groups wherein this information goes. So you can join the link which has been shared with you in the chat box right now. जो हम में से जो लोग आरोग्य धाम के ग्रुप में नहीं है और ये रिकॉर्डिंग देखना चाह रहे हैं, वो अभी आपके चैट बॉक्स में दिए हुए लिंक को अगर क्लिक करेंगे, रिकॉर्डिंग करीब 1 वीक का समय लगेगा इसको यूट्यूब लिंक पे अवेलेबल होने के लिए, फिर आप उसको देख सकते हैं, है ना? I think with that looks like we have come to end of today's session. Dr. Riya, thank you so much. Participants अभी भी है, but I think अगर आपकी तरफ से कुछ आप आगे भी भेजना हो, which means you would like to share with them, you can send it to me. We will have it sent to all the participants in all the groups. Yeah.
Perfect. Thank you so much, Anushree. Thank you so much, everyone, for patiently listening to me. आपने मुझे इतना समय दिया, इतना प्यार दिया, इतना attention दिया while listening to me, and I hope मैंने जो भी आज बोला है या जो भी आपको information मिली है वो आपके life को और beautiful और better और happy बनाए. सबसे ज़्यादा important happiness है. So yes, thank you so much, Tanashri, and goodbye, everyone. Good night. Jai Gurudev.
I think looks like Prasanna ji has unmuted herself. Just wanted to check. Prasanna ji, कुछ पूछना चाह रहे हो?
No, I just want to thank doctor. It was really good. Thank you so much.
डॉक्टर नहीं, सरिता जी, आपने अपने आप को अनम्यूट किया, कुछ पूछना चाह रहे हो? ठीक है, I think I just thought कि maybe they wanted to ask something. With that, thank you so much once again. Take good care of yourself.
Thank you so much. Bye-bye.
So we'll end the meeting now. Bye for now. Good night. Alpesh ji, good night.
Good night. Thank you.
Thank you and good night.
Bye Prasanna ji. Bye me.
प्लीज उनका नंबर दीजिए.
उनका नंबर हमने चैट में डाला है, मैं अभी डाल रही हूँ. तीनों का नंबर है, तीनों टीचर्स हैं. टीचर्स है. 1 मिनट. आप यहाँ पे चैट से पिकअप कर सकते हैं. अभी जस्ट मैंने लास्ट मैसेज जो डाला है फिर से एक बार, और अगर आपको दिख नहीं रहा हो तो मैं एक बार पढ़ के बता देती हूँ. डॉक्टर रिया का नंबर है 81699325 I repeat 8169932352.
थैंक यू.
अगर आपने नोट किया हो तो फिर मैं मीटिंग बंद कर देती हूँ अभी के लिए, है ना? ठीक है. ऑल राइट. बाय डॉक्टर अमृता जी. सी यू. किरण जी, बाय बाय. गुड नाइट. प्रियंका जी, we are really glad that we found it meaningful and some benefit. Lakshmidhar ji,
thank you so much.
Yeah, Lakshmidhar ji, good night. Bye bye.
Good night. Actually, we wanted doctor to tell us once more about the exercises. No?
It will be available in recording.
Okay. Thank you.
But you are one inspiration for us. We have seen you practicing and performing in so many things. I'm sure it will be beneficial, you know. Milenge, you know. All right. Bye bye, Bhavna. Daji, bye. Daji, bye. Sudhirji, see you next time. Bye, Garima ji.
Jai Gurudev.
Gurudev. So with that, I'm closing the meeting for now. We'll see you next time, next Tuesday, 8 p.m. with another topic.
Okay, thank you. Thank you very much.